Dr. Gerald Ravens, a physician and researcher from Stanford University, identified a constellation of problems individuals develop when they become less and less sensitive to their own insulin. This is referred to as insulin resistance. When the body becomes less sensitive to its own insulin, it compensates by actually making more and more insulin. But as these blood insulin levels begin to rise, you literally tip over into an abnormal metabolic state, which is referred to as the metabolic syndrome or prediabetes. These individuals usually develop central obesity or central weight gain, high blood pressure, elevated triglyceride levels, that's the other fat in the blood, elevated VLDL cholesterol or that very bad cholesterol, low HDL or good cholesterol, and they are at very high risk of developing both heart disease and diabetes. You can see why Dr. Ravens has reported that individuals who have this full-blown metabolic syndrome have a 20-fold increased risk of having a heart attack or stroke. When you tip over into this abnormal metabolic state, your arteries literally begin aging a third faster than normal. In other words, for every third birthday, just add another year. Over time, your body just can't keep making all this insulin, and blood insulin levels begin to drop. However, now your blood sugars begin to rise, and you not only become diabetic, but your arteries begin aging even faster. Insulin resistance is directly the result of our poor eating habits and lack of exercise, which causes us to become less and less sensitive to our own insulin. The medical literature shows us that over half of the adult population and nearly 1/3 of our children are in some stage of insulin resistance today. It is not only the reason we are seeing the epidemic of obesity, but also the reason we are seeing the epidemic of diabetes. However, since it's poor lifestyles that are the cause of obesity and diabetes epidemics, it only makes sense that we need to firmly establish newer, healthier lifestyles that improve insulin sensitivity in order to avoid or reverse these problems. I spent over 3 years researching the medical literature to learn which lifestyles are best for improving insulin sensitivity. In fact, the American Association and College of Endocrinology, or those diabetes specialists, are now recommending that physicians treat this prediabetes or metabolic syndrome as aggressively as we do diabetes, because the accelerated aging of our arteries begins as soon as we tip over into this abnormal metabolic state. When they reviewed the worldwide medical literature, they concluded that the best treatment is to make intensive lifestyle changes.